Have you ever felt it? That sudden flutter in your chest, the feeling of your heart skipping a beat or suddenly racing for no apparent reason. It can be a terrifying moment, one that sends your mind spiraling. Is this just a harmless hiccup, or is it a sign of something much more serious? If you felt that fear, you are not alone. Millions of people experience heart palpitations, and the vast majority of the time, they are completely benign. But how can you know for sure? How do you tell the difference between a minor flutter and a major problem? Today we're going to break down everything you need to know about heart palpitations. We'll explore what they are, their common causes, and most importantly, when you absolutely need to seek medical help. Our goal is to give you the clarity and confidence to understand what's happening in your body and know how to respond. So what are heart palpitations? Simply put, a palpitation is any time you're suddenly and unpleasantly aware of your own heartbeat. Most of the time, our hearts beat away in the background and we don't even notice. Palpitations are when that quiet rhythm suddenly makes itself known. People describe the sensation in many different ways: a flutter, a pounding, a racing heart, a flip-flopping feeling, or the sense that your heart has skipped a beat. You might feel it in your chest, your throat, or even your neck. These episodes can last for just a few seconds, or in some cases for several minutes. It's important to remember that palpitations are a symptom, not a diagnosis. They're your body's signal that something has changed your heart's rhythm. This change can be triggered by a huge variety of factors, many of which are totally harmless. However, palpitations can sometimes be a sign of an underlying arrhythmia, an irregular heartbeat that might need medical attention. An arrhythmia can cause your heart to beat too fast, too slow, or in an irregular pattern. So while most palpitations are nothing to worry about, it's essential to understand the full picture. Now that we know what they are, let's talk about what actually causes them. The list is long, and some of the most common culprits might surprise you. Many triggers are part of our daily lives. That morning coffee? The glass of wine with dinner? Both caffeine and alcohol are very common triggers. Nicotine is another big one, whether from smoking or vaping. Even being dehydrated can throw off your body's electrolytes and lead to an irregular heartbeat. And if you've ever felt your heart race during a tough workout, you've experienced exercise-induced palpitations, which are usually normal. Then there's the powerful connection between mind and body. Stress, anxiety, and even strong emotions like fear can release adrenaline, which naturally speeds up your heart rate and can cause palpitations. In fact, anxiety is one of the most common non-cardiac causes. A panic attack, for instance, can feel frighteningly similar to a heart attack, with a racing heart being a primary symptom. Hormonal changes can also play a role. Many women report palpitations during pregnancy, menopause, or even their regular menstrual cycle as hormone levels fluctuate. Certain medications list palpitations as a side effect. This can include some asthma inhalers, decongestants in cold medicines, and even some drugs for high blood pressure or thyroid conditions. And finally, sometimes palpitations do point to an underlying medical condition. These can include an overactive thyroid gland, hyperthyroidism, anemia, low blood sugar, and of course certain heart conditions. The key is to start paying attention to your personal triggers. A great first step is to become a detective of your own body. Try keeping a simple journal of when your palpitations happen, what you were doing, what you'd recently eaten or drunk, and how you were feeling emotionally. These clues can be invaluable. The good news is that if you only experience occasional, brief palpitations without any other symptoms, there are things you can do to manage them. These techniques often focus on calming your nervous system and stimulating the vagus nerve, which helps regulate your heart rate. One of the simplest and most effective things you can do is practice deep, diaphragmatic breathing. The next time you feel a flutter, find a quiet place to sit down. Place one hand on your belly. Inhale slowly through your nose for a count of 4, feeling your belly expand. And then exhale slowly through your mouth for a count of 6. Repeating this for a few minutes can help slow your heart rate and calm your nerves. You can also try something called a vagal maneuver. These are simple physical actions that stimulate that vagus nerve. For example, you can try coughing forcefully. Another is to pinch your nose, close your mouth, and bear down like you're having a bowel movement for about 10 seconds. Even just splashing your face with cold water can have a similar calming effect. Lifestyle adjustments can also make a huge difference. If you know caffeine is a trigger, try cutting back. Make sure you're staying well hydrated. And since stress is such a major factor, building stress management techniques into your day, like yoga, meditation, or just a quiet walk can be incredibly helpful. Nutrients like magnesium, found in leafy greens and nuts, are also important for maintaining a steady heart rhythm. Remember, these are strategies for mild, infrequent palpitations. They are not a substitute for professional medical advice. If your palpitations are becoming more frequent, lasting longer, or are joined by other symptoms, it's time to take the next step. We're about to cover the most critical information in this video, the red flags you must not ignore. If you're finding this kind of clear, evidence-based health information helpful, please take a moment to subscribe and click the notification bell so you don't miss our future updates. Okay, this is the most important part of our discussion. While most heart palpitations are harmless, some are a sign of a serious, even life-threatening condition. Knowing these red flags can make all the difference. Let's start with the absolute emergencies. If you experience heart palpitations along with any of the following symptoms, you need to call 911 or your local emergency number immediately. It is not safe to drive yourself to the hospital. Chest pain or discomfort, which can feel like pressure, tightness, or squeezing. Significant shortness of breath or struggling to breathe. Dizziness, lightheadedness, or actually fainting. This could mean your brain isn't getting enough oxygen. Breaking out in a cold sweat for no apparent reason. Pain that spreads to your neck, jaw, or arms. And if the palpitations won't stop after a few minutes, or if your heart rate feels extremely fast and chaotic. Now, not every concerning situation is a 911 emergency, but there are definitely times you should make an appointment with your doctor. Please schedule a visit if your palpitations are happening more often or are lasting longer than they used to. You have a known heart condition or a family history of heart problems. You have other health issues like diabetes, high blood pressure, or thyroid disease. The palpitations are causing you significant anxiety or are getting in the way of your daily life. When you see your doctor, you can expect them to ask about your symptoms and lifestyle. They may order tests like an EKG to record your heart's electrical activity. Sometimes they may ask you to wear a portable heart monitor for a day or even a few weeks to get a clearer picture of what's going on. One of the main conditions your doctor will want to rule out is atrial fibrillation, or AFib. AFib is a common type of irregular heartbeat that significantly increases the risk of stroke and heart failure, especially as we get older. This is a perfect example of why getting persistent palpitations checked out is so important. Early diagnosis and treatment of conditions like AFib can save your life. That flutter in your chest is a complex and often frightening sensation. But by understanding what it is, what might be causing it, and when to get help, you can move from a place of fear to a place of empowerment. For many people, a few simple lifestyle changes can make all the difference. For others, a visit to the doctor provides either priceless reassurance or a diagnosis that can be managed effectively. Ultimately, you are the #1 expert on your body. Don't ignore what it's telling you. That awareness and your willingness to take action is the most important step you can take to protect your heart and your health. Thanks for your time today, and be well.